primary healthcare center in fostering health equity and enhancing health outcomes cannot be overstated, especially in the low-income country. Primary healthcare has become a pivotal component of the healthcare delivery system and plays a crucial role in boosting the healthcare system in Nigeria, promoting positive outcomes and equity. The Nigerian government has now reaffirmed its commitment to universal healthcare coverage, prioritizing healthcare and collaboration with stakeholders in improving healthcare in the country. Now, joining us from our Abuja studio is the Minister of Health, State for Health, Isiat Salako. Many thanks for joining us on the program this morning. Good morning. Thanks so much for joining us.
Thank you very much. It's my pleasure to be here.
All right. Healthcare delivery is crucial to the development of a country. And how satisfied are you with the level of universal health coverage that we have in the country at the moment?
Well, I think that it's work in progress. The reality is that when the National Health Insurance Scheme was introduced, sometimes in 1999, I think, it was made voluntary until about 2-3 years ago when the enabling law was now reviewed and now made compulsory. As a result of that, the participation in the health insurance scheme has continued to increase. In the last 1 year, as an example, we have been able to move the enrollment inside the National Healthcare Insurance Scheme from about 16,000 to around 19,000, an increase of about over 15% in 1 year. So, which means that if we are able to maintain that kind of traction within the next 4 or 5 years, we will be having about 60 to 70% of Nigerians covered by health insurance, which will be a significant milestone. So we continue to work in that direction because the whole essence of universal health coverage is to ensure that every Nigerian have the health care they need at any point in time without any financial constraint. So government is committed to that, and is one of the key agenda of President Bola Ahmed Tinubu to ensure that the target of ensuring universal health coverage for all Nigerians by 2030 is achieved.
How satisfied are you with the level of universal health coverage that we have in the country at the moment?
Like I said, it continues to be work in progress. Okay. At the moment, we have about 19 million Nigerians covered by the health insurance scheme, outside other informal schemes by corporate organizations, by some private providers. But within the National Health Insurance Scheme, we have about 19 million Nigerians covered.
Well, according to a report from the World Bank Human Capital Public Expenditure Review, over 1 million Nigerians are pushed to poverty every year due to health-related expenses. What mechanism is in place to reduce these particular challenges that we are having in the country?
One of the key mechanisms that the government has adopted, which is provided by the National Health Act, is the provision of the Basic Healthcare Provision Fund, which provides that 2% of the consolidated revenue is made available to provide a basic health package for the vulnerable Nigerians. Government has continued to implement that, and in 2024, in the region of about 15 billion was deployed or disbursed to the states and then to selected primary health care centers across the country to be able to provide basic health care for Nigerians, so that when Nigerians go there, there's a basic level of health care they're able to get as a result of the provision of the Basic Health Care Fund. So on a quarterly basis, through this Basic Healthcare Provision Fund. Some money is made available to selected primary healthcare centers across the country to support procurement of drugs, to support logistics, to support power, to support staff, and so on and so forth, so that at every point in time, these healthcare facilities are ready to attend to Nigerians. So addressing the challenge of poverty as a result of healthcare will be global when we are able to increase the level of participation and the level of registry enrollment into the health insurance scheme. Because the whole idea of a health insurance scheme is to prepare for the rainy day, so that you do not have to dip your hand into your pocket when you need to access healthcare. So once we continue to increase the number of enrollment in that, we'll also be in the same way addressing the challenge of poverty as a result of healthcare.
What sensitization mechanism is the government putting in place to let Nigerians are aware about this development, especially to the vulnerable in the country? How regular is this sensitization?
We continue to do the sensitization. You know that first, primary healthcare centers belongs to the local governments, but the federal government, through the National Primary Healthcare Agency, the National Health Insurance Agency, and other gateways, continue to intervene at the primary healthcare level through provision of infrastructure, provision of funding, training, and so on and so forth. So a key element of our intervention in the primary healthcare level is sensitization and creation of awareness. And at the moment, we're implementing an initiative where within each local government, we're going to have what we call health fellows appointed by the federal government and paid by the federal government. The whole essence of the health fellows is to work with the health authorities at the local government level to increase level of awareness, to also increase level of utilization of our primary healthcare facilities. Of course, we also depend on the fourth estate of the realm, media practitioners like your good self, to also continue to help us to upscale the level of awareness that is available to Nigerians.
Let's talk about some critical health challenges in the country. There's this report that about 80,000 Nigerians die of cancer annually, and over 100 are diagnosed of cancer. These figures are increasing by the day. Tell us, what is the federal government doing to tackle this scourge in the country? The scourge of cancer.
Yes, thank you very much. Cancer is a particularly challenging problem because when somebody comes down with cancer, it not only affects the individual, it affects the family, it affects the community. It's one of the drivers of poverty. And the prevalence of cancer is continuing to increase in our country. So the federal government has a multi-pronged approach to addressing the issue of cancer. The first approach is to ensure that we focus majorly on prevention of cancer through primary prevention. Primary prevention means that we're able to, cancers that are vaccine preventable, we address them like cervical cancer, which last year we were able to immunize about over 12 million young girls against HPV, human papilloma virus, which is a causative organism associated with cervical cancer. We're also immunizing against hepatitis B, which has also been incriminated with the development of liver cancer. So at the primary level, and also, of course, talking about the modification of habits, our diets, our smoking habits, improving level of exercise, all those ones, we are emphasizing at the primary healthcare level, at the primary prevention level. At the secondary prevention level, we're also focusing on early diagnosis, because most of the cancers, when you're able to catch them early, the prospect of a cure is very high. Quite a number of cancers also have what we call the precancerous stage. And if you are able to discover at the precancerous stage before the full-blown cancer comes up, then it is also easier for you to manage. So there's a lot of emphasis also on secondary prevention. And at the third level is to now expand our ability to treat and manage people who have cancer, who develop cancer in the country. So you will see that last year, the process of expanding the cancer infrastructure in Nigeria started. And this year, before the end of the second quarter of this year, we will be commissioning 6 comprehensive cancer centers across the geopolitical zone, 3 first before this end of second quarter, and before the end of this year, 6 will be also commissioned, so that when people have cancers, they have where to go to get treatment. In addition to those comprehensive cancer centers, we're also developing cancer centers in some of our tertiary health facilities. In Ebute Metta, for example, there's a cancer center being developed that will soon be commissioned. Here in Abuja, a cancer center is being developed. Across the country, we're having that. Government is also procuring equipment, linear accelerators, bradycardia machines, radiation therapy machines that can be used for the treatment of cancer. We also have the Cancer Health Fund, which is provided to support patients, Nigerians who have cancer, that are not able to afford the treatment, particularly expensive drugs that are required for the treatment of cancer. That Cancer Health Fund is also being expanded this year so that more people can have access to the Cancer Health Fund. We're also expanding the number of cancers, the number of centers that can access the Cancer Health Fund. So this is the comprehensive approach that government has adopted to address the challenge of cancer in the country.
How accessible is this Cancer Health Fund? Because when you talk about it, some Nigerians will tell you that it's not easy for them to access these funds.
Well, what I can tell you is that any mechanism of government like this, when we put it down, we have to put stringent measures to prevent abuse. Because if there are no stringent measures, the possibility of abuse is high. So for you to be able to access the Cancer Health Fund, first, you must be getting treatment in some specific centers that are registered by government and have an electronic template that you can use to access it. So it is not that every Dick and Harry, by all means, because first, this Cancer Health Fund is for the vulnerable people. People cannot afford it. So which means that if you want to afford it, you have to be able to also justify that you cannot afford treatment. And it must be at a registered center. It must be with registered caregivers that know the rudiments of people accessing that fund. So I would say, generally speaking, if one is diligent and ready to go through the whole hog of the measures, the Cancer Health Fund is available to be accessed.
Absolutely. If they can go through the rigorous process, it is very easy for Nigerians to access this. Let's talk about the issue of brain drain in the country. There are statistics all around talking about the numbers of doctors leaving the country at the moment. Even the coordinating minister of health, Ali Pate, last year made a statement that about 16,000 medical doctors leave Nigeria to other countries, most especially the US and the UK. Are you worried about the exit of licensed doctors to developed countries in Nigeria, to developed countries of the world?
Well, definitely we are worried because the government of Nigeria spent a lot of money to train doctors, to train health workers. If you want to become a doctor in Nigeria, and then you compare what it takes you as an individual to become a doctor, compare it to what it takes you to become a doctor maybe in UK or in Canada or in the US, you see that it is about 10 times. So government subsidize the training of health workers, doctors, nurses, pharmacists significantly. So when we have invested so much resources on these people, train them to become qualified, and they now exit the country, definitely government will be worried. But government is looking at it from both the positive and negative angle. The positive angle is first that when people have the opportunity to go out, they are able to build network within the global health community. They can improve their skills. They can improve their exposure. And if you set mechanism in place in the country, we can also harvest those improvement of skill, improvement of networks, improvement of knowledge that have acquired by going outside the country. As a result of that, we have put in place a health migration policy to help us harvest those positive sides of the migration of health workers from Nigeria. I continue as Minister of State interface with health workers in the US, Nigerian health workers, health professionals in the US, in the UK, in Canada. Recently, our health workers in Germany too also came forward. And the whole essence of our interface is, in these days of digital technology, there's a lot of things that we can get done without them being physically present. And occasionally, we can also bring them around to be part of the healthcare delivery system of Nigeria. So that's on the positive part. On the negative part, of course, is the rapid depletion of our healthcare force, which we are not very, very happy, we are very worried about. To address that, we are also expanding our capacity to train health workers, to graduate doctors, nurses. We are expanding the training facilities. We are also harvesting the knowledge and the participation of these health workers that have migrated. Later in the year, in March, I will be participating in the UK African Health Summit, where one of the key discussions of that summit is how will Nigeria be able to benefit from the migration of health workers that are trained in Nigeria with Nigerian resources. So it is one of the issues that we're going to be discussing at that summit. So at the end of the day, we're putting together a package, whereas we cannot stop anybody from migrating, but we want to ensure that when Nigerians health workers that have been trained with Nigerian resources migrate outside the country, Nigeria is still able to benefit from the investment on those people.
Don't you think if the working environment is conducive, some of these doctors will not leave the country? Do you also consider that?
Yes, we are constantly improving the working environment for our doctors. I think that in the last 1.5 years, or going to 2 years, since President Bola Ahmed Tinubu took over the mantle of leadership of this country, if you go around our health facilities, you see dramatic improvement in terms of renovation, in terms of improvement of infrastructure, in terms of making equipment available, diagnostic equipment to support whatever they're doing. With respect to their remuneration too, government is also doing its best. Within the economic affordability of Nigeria, health workers in Nigeria are one of the most highest paid. If you compare average health worker to average civil servants in Nigeria, for example, you will see that health workers are better paid, which means that the government of Nigeria prioritizes health workers' welfare in terms of salary. But because the salary we're going to pay must be within the ambit of the affordability of Nigeria, and it must also respect the relativity issue, because we cannot pay health workers and not consider the relative. For example, a teacher, how much should a teacher be earning relative to a doctor? So if we are going to increase the salary of a doctor, for example, by 2%, we must also be ready to increase the salary of a teacher by the equivalent percentage, so that the relativity can be maintained. Otherwise, we'll have a lot of industrial crisis on our hands. So what I can tell you that government is committed, and we continue to do everything possible within the economic capacity of Nigeria to promote the welfare, to prioritize the welfare of health workers in Nigeria generally.
Let's talk about your recent medical tour to federal institutions in the country, in Lagos and in Edo. What is the significance of this tour?
Well, what I have decided as a Minister of State is that to visit one state per geopolitical zone that has the largest concentration of federal tertiary health institutions. So I started with the Southwest, I visited Lagos, and then I now went to the South-South, visited Edo State. In Southwest, Lagos has the highest concentration of federal tertiary health institutions. In the South-South, Edo State has the highest concentration. And the whole essence of that visitation is first to also see firsthand some of the working environment, the challenges, and also interface with the health workers directly, interface with patients, and in some instances, interface with the health authorities at the state level. For example, when I visited those states, because of a few challenges that we were having in the past with some of the things we were trying to do in Edo State, I had to interface with the governor of Edo State. And my interface helped significantly because on the spot, the governor of Edo State provided 100% of my ask to support some of the things we are doing in Edo State. As an example, government has established the National Obstetric Fistula Center for the South-South in Benin. This Obstetric Fistula Center was established sometimes in 2019. Up to today, the Obstetric Fistula Center is not able to run optimally because we are not getting the optimal support that was required from the state actors. But my visit has been able to help. Now we have a support of the government. They have provided 22 hectares of land for the permanent site. The Edo State government has also provided a temporary site for operation. They have also provided some funding for the renovation of the temporary site. I also visited the National Orthopedic Hospital Benin, which is also a newly established federal tertiary institution in Edo State. And I also saw some of the challenges that they are facing in that place. Immediately I came back, I interfaced with the SDG office, and some of the things that the SDG office needs to do to support that place, we are still able to get it forward. So that visit is basically to drive the agenda of President Bola Ahmed Tinubu to ensure that every Nigerian have access to qualitative, effective healthcare.
Absolutely. Before I let you go, just in 30 seconds, your new role as the Minister of State for Health at the moment, from Minister of State for the Environment, how do you see your new role now? What are the new challenges that you're facing, and how do you succumb all these challenges that you're passing at the moment?
Well, for me, first is to say that my transition from environment to health is a blessing. I think that I think some spirit ministers to Mr. President, because when I was deployed to environment, I was looking at it that, well, I'm not really sound. Although I had some environmental exposure as a public health physician, I did a lot with environmental health, but I felt that, will I be able to cope? But when I got there, I realized that the impact of the environment itself on the health of our people is major, is significant. And taking my knowledge, having participated, having superintended within the Ministry of Environment for about a year to health, is significantly helping me to integrate. Because when you look at our health architecture as a whole, you will find out that the social determinants, what we call the social determinants of health, including the environment where we reside, where we work, where we play, is a very, very major contributor to the health status of the people. And that is why, globally, the approach of One Health, which integrates the approach of the environment, the agriculture, water resources, and the health into providing comprehensive, holistic health care to our people is now a global phenomenon. So my transition from environment to health has significantly helped me. And so as a result of that, you will see that coming into the Ministry of Health, I've prioritized the agenda of One Health to ensure that we see health more holistically beyond just hospital care, beyond just facility care. And you will see that the president also had that vision, because when he was renaming the Ministry of Health, he made Federal Ministry of Health as Ministry of Health and Social Welfare. That social welfare is to reflect the heavy impact of social determinants of health in the health status of the people. So in this new year, you will see us doing a lot of activities around the social determinants through the Social Action Fund that Mr. President
I can see your passion in the health sector at the moment, but time will not permit us to continue with this. We must say many thanks for joining us on the program this morning. Minister of State for Health and Social Welfare, Dr. Isiaq Salako. Many thanks for joining us on the program this morning.
Thank you very much for having me.